Good morning, everyone. My name is Amy Desai, and I'm the Chief Operating Officer and Administrator here at Caleb Hitchcock Health Center at Doncaster. It is my honor to welcome the Honorable Governor Ned Lamont, Public Health Commissioner Dr. Manisha Juthani, Social Services Commissioner Dr. Deidre Gifford, Long-Term Care Ombudsman Mairead Painter, and all of you to our 60-bed nonprofit nursing home that is part of our Doncaster Life Care community. As I stand here today in our nursing home, I can't help but reflect how far we have come in the last 2 years and how pleased we are today to be with all of you in person to showcase our resilient staff, our amazing residents, and our supportive families and friends. We are now 2 years stronger, and we have many to thank for that, and most especially our partners at the state who are with us today and who have supported us through these 2 years. For their support with PPE when we needed it most, with testing resources, with information, and with consultation. Our governor and the Department of Public Health have been right by our side, and we have been in this together, collaborating as partners, and we are all stronger for it today. You know, every nursing home throughout the country had to quickly respond to the spreading pandemic in early 2020. Here at Doncaster, we used a strategy of developing 4 C's as our pillars. Those 4 C's were care, compassion, containment, and communication. This helped us fight the virus. We took those pillars, and with every step we took, we related back to these 4 C's. Our entire staff continues to be dedicated to these pillars, and they are doing a phenomenal job while giving our families and residents the ability to be involved and to be in touch, and providing them with constant education on guidelines that are constantly changing. We are recognizing that at some level, this is going to be our new norm. We have learned to pivot, we have learned to use our knowledge, and we are so much better prepared for whatever the future may bring. I am so proud to say that we are very close to about 99% of our staff having received the booster dose. I want to recognize some of our team members, especially our medical director, Dr. Somia Kurtakoti, for her guidance throughout the 2 years, our director of nursing, Kristen Pellegrino, and our infection preventionist, Naoka Duncan, who continue to lead our infection prevention efforts using DPH guidelines, developing policies, and educating and supporting staff. And to John Shalensky, our board chair, who is here today, for his unwavering support, and to each and every one of our staff, all of whom have touched the lives of our residents. To all, I say thank you. And now it is my pleasure to begin the program by introducing Mairead Painter, State Long-Term Care Ombudsman.
Good morning. Thank you for having me here today. You'll notice I didn't come up with any notes, and that's because I really don't feel that I need notes to be able to recognize what our administration, the governor's office, our commissioners, residents, family members, and nursing homes from around our state have done for the past 2 years in order to prioritize and protect the residents that live within these homes. The residents and family members were kept as a top priority whenever we talked about next steps, new guidance, and how it would affect them. I am honored to be from Connecticut and know that every time new guidance came out, information, I was given the opportunity to speak directly to leaders that were making these decisions and also to give them feedback from the residents that we work with who give me information to ensure that any kind of impact or changes that were going to happen was totally informed. Now, things didn't always go exactly the way we wanted. However, we knew that in dealing with this pandemic, things were going to change on a day-to-day basis. We're one of the only states in the country to have an executive board of presidents of resident council, and I'm honored today to be joined by one of our residents, John, who's going to speak in a moment. But I want to thank the governor for reaching out and speaking directly to members from our e-board being informed by them on how things impact them, and using that information when he was going to have to put out guidance. And no, it wasn't always guidance we wanted to hear, but some of the parameters were put in place by the federal government, and we had to do our best in order to lift and shift. And as you just said, we had to be really good at changing on the fly. Our administration made sure that it was a priority that residents received the vaccine first, that they had access to information, and we even had individuals from the Department of Public Health who took questions daily on our Facebook Lives from residents and family members to ensure that they were getting the information from the source. They weren't relying on it coming through the home or through the news, and to me, that's the best way to keep people informed. So I really want to thank you, thank all of the staff here, and my commissioner, Amy Porter, as well as my team. I don't think we could have done any of this without the frontline staff from the Department of Public Health, the Department of Social Services, Aging and Disability Services, and I don't know of another state that came together to work on communication, again, prioritizing the individuals who were in the crosshair of this pandemic, and that is our long-term care residents. Because of that, today, the majority of our residents have had their boosters. They've had access to any type of testing necessary to keep visitation open. And I'm thankful to say I have not received a visitation complaint in many months now, which is a joy for me. So thank you very much. And I want to introduce John Beliciano. So John, if you want to come up. And he's going to tell you a little bit about his experience throughout the pandemic.
Good morning. My name is John Beliciano, and I'm from the Connecticut E-Board, and I'm from Shelton, from Ewitts in Shelton. I reside there. I'm there 3 years already. And I just want to thank the governor and the administration for keeping the nursing homes residents a priority and getting the information out to us, along with our Ombudsman and everyone else there. And my home has pretty much what it needs to protect me from COVID. We've been doing rapid testing. We've been doing other things to keep us safe. With the governor's current testing process, we have been able to keep visitation open at all times, even when people do test positive. And the E-Board had an opportunity to meet with the governor last month to talk about COVID and what is happening in the nursing homes. And for that, thank you, Governor. We appreciate the governor and the administration working to do this with us, and not just for us. He does it for all the nursing homes in Connecticut. My primary concern at this time is staffing in the nursing homes, because a lot of times we work short-staffed, and it's very hard to get the help we need. I mean, I'm independent, but I see some other residents around me that need the help when their call light goes on, and there's no CNAs around to help them. So being shorthanded is really an issue. So I look forward to working with the governor and the administration this session to pass something to help alleviate the staffing concerns that all nursing homes have. And I'm willing to work with my e-board members to come up with ideas and to bring them forth to all our representatives and to our governor as well. Thank you.
There you go. Thank you. Thank you.
And now I'd like to invite Matthew Barrett, President and CEO of the Connecticut Association of Healthcare Facilities and the Connecticut Center for Assisted Living. Matt?
Well, thank you very much. Here we are 2 years into the, I'll call it an unrelenting pandemic. And operators I speak to tell us that in their 40 years experience, they've never had challenges like they've experienced over the last 2 years. It has impacted nursing home residents, nursing home caregivers, and operators really in every respect, and really since the onset of the pandemic, when this misunderstood or little understood virus was transmitting through persons who were showing no symptoms. This is something that our healthcare system never experienced before, and this was particularly troublesome, near the epicenter of the virus in Connecticut, near New York City, and we were severely impacted early on. And so we've experienced really every feature of the virus, including the most recent Omicron surge that really had outbreaks in every single nursing facility in Connecticut. And while the experiences have been extraordinarily and maybe extraordinarily traumatic, the response and resilience of our staff, of our operators, has also been extraordinary. And so I like the sign behind us that says, "We got this." I think that it's reflective of the determination and resilience of our employees in this call to battle. And so I express my gratitude to all of our employees, and I also want to express my gratitude to Governor Lamont and his executive team, Commissioner Juthani and Commissioner Gifford. I could say that they have had their hand on this steering wheel right from the beginning, and they're holding it firmly even now. And regrettably, Governor, I think we're going to have to hold on just a little bit longer, but we are grateful for your unwavering support. Thank you.
Thank you, Matt. The next person that I'd like to introduce today really is our fifth pillar. I talked about the 4 pillars: care, compassion, communication, and containment. Meg Morali, who is the president of Leading Age Connecticut, has been our 5th pillar all along, by our side every step of the way. Meg, I can't remember the times that I've called you, sometimes in the middle of the night, not really knowing what to do, looking for guidance, and Meg every single time came through. So thank you, Meg, for all your support and everything that you have done. Without further ado, Meg Morali, President of Connecticut Leading Age.
Thank you, Amy. It was my pleasure to be your 5th pillar, and just so you know, when you called me in the middle of the night, I then called Barbara Cass in the middle of the night. So, and it is my pleasure, really, to be here at Doncaster, one of our Leading Age Connecticut members, to share in spreading the message that Connecticut nursing homes are a safe place to live a safe place to visit, and a welcoming and rewarding place to work. It's been almost 2 years, and our nursing homes have worked very hard to implement the policies and the practices that are making our nursing home residents feel safe, secure, and comfortable, and in the place that they call home. And in a world that's surrounding us with this virus, we continue to improve on our ability to mitigate the spread, contain the outbreaks, and protect our residents. And this didn't just happen. As you've been hearing, these outcomes are the result of a truly dedicated workforce and a strong collaborative partnership with the Department of Public Health. It has been and continues to be a truly collaborative effort, and we are so appreciative of the department's expertise and guidance. And of course, we couldn't be where we are today without the leadership of the governor, so thank you. Our nursing homes have gotten very good at fighting against this virus, and we thank you, Governor Lamont, you, Commissioner Juthani, and Commissioner Gifford, who was there in the beginning helping us move us along. For all you've done to help us get us here, thank you so much. And finally, I would be really remiss if I didn't mention how much we appreciate the patience, the understanding, and the cooperation of our visitors, and most of all, how deeply we value our residents. You are why we do what we do, and we thank you for trusting us and for supporting our efforts to fight this virus. So thank you.
Thank you, Meg. And now, Commissioner Dr. Manisha Juthani.
Thank you for having me here today. You know, when this pandemic started 2 years ago, we didn't have the tools in the beginning because we really didn't know what the virus was. And nursing homes were unfortunately hit hard in the beginning. Being close to New York, having the virus come up the I-95 corridor. But with the leadership that we had in this state under Governor Lamont and Commissioner Gifford, who came in to help address this situation right in the beginning, what a success story we've had in the long-term care industry here in Connecticut. Our residents in nursing homes were some of the first to get vaccinated. And with that, what we have seen, I'll show you a little graphic, is that with each wave of this virus, there may have been increases in cases, which is the blue, but the red line shows the deaths, which have gone down dramatically in patients living in long-term care here in the state of Connecticut. And this is a remarkable story. It's a remarkable story about what teamwork does. When you know how to deal with the virus, PPE, learning infection control measures that can be done in the nursing home setting, and of course, vaccinations and boosters, which really helped get the residents through this Omicron wave. And I'm so grateful for all the staff in a home like this, 99% boosted. What a remarkable achievement so far. You're doing everything that you can to protect the residents who we all work to serve in these communities. Because of the expertise, and I'm just so grateful for the leadership that Commissioner Gifford brought in through Chief of Staff Lita Orifici, Dr. Vivian Leung, who many know in this room, and Barbara Cass, who is our branch director of healthcare quality and safety, with leadership in infection control measures and ways that we can protect our patients. DPH has been able to work with all the different facilities in this state through various different stages to really protect residents. And new challenges have come along the way, and we've had to learn how to adapt to surging cases in the hospital and still allowing for the safe care of patients here in nursing homes. And so I am so hopeful as we move forward to the next stages, as we emerge from what hopefully is becoming less of an emergency response. And as we know how to deal with this virus, and we know that we can get through this by using all those things that we've talked about, with vaccination boosters being at the forefront, but all the infection control metrics, relying on the staff in places like DPH who are helping homes learn how to manage infection control practices, incorporate best practices to constantly innovate and find ways to be able to care for our residents best, because at the end of the day, that's who we're here to serve. So I want to thank everybody in the industry. I want to thank all of our partners. I want to thank Commissioner Gifford, who helped bring me into this role and take over from where she left off, and of course, the governor, who led us all through this pandemic in the last 2 years. Thank you.
Well said, Dr. Juthani. Thank you. And now, the Commissioner and Senior Advisor, Dr. Deidre Gifford.
Thank you, Amy. Good morning, everyone. Governor, Commissioner Juthani, Matt and Mag, Mairead and John. We're here this morning really to acknowledge the challenges that we have faced in the nursing home industry over the last 2 years and celebrate the successes. It really, as Commissioner Juthani said, is a remarkable story. I want to thank not only the staff here at Doncaster for your incredible hard work over the last 2 years, but to thank every single employee and staff member in the nursing home and long-term care industry in the state of Connecticut. It has been really a grueling couple of years, and at the forefront have been the CNAs and the nurses and all of the staff, the dietary staff, the cleaning staff, all of the staff in our nursing homes who have risen to the occasion and put the residents' safety first. We at the state are enormously grateful and will never forget their commitment and dedication. So let me again publicly say thank you to everyone who works in the industry. I want to say a special thanks to Mairead. She is modest about her role in advocating for patients and families in the nursing homes and in long-term care. We did have, from the beginning of this pandemic, when I started in the role at DPH in May and even before that of 2020, a very strong partnership with our long-term care ombudsman and the state agencies that were involved in regulating and overseeing the pandemic response. That does not exist in every state. And because of Mairead's approach, which is to strongly advocate, but in a very constructive and helpful way, we were able to, sometimes every day, be talking with her about what she was hearing on the ground from residents. She never stopped advocating for residents and their families, and that information helped us to respond in a way that kept residents and families at the center. So thank you, Mairead, for your incredible work. It's been a pleasure to work with you. So as you've heard, our response and the really encouraging data that Commissioner Juthani showed about the decreases in nursing home deaths as a proportion of all deaths with each subsequent wave here in Connecticut, that was achieved really through a foundation of partnership. It was a partnership with the industry and the state, and those are relationships that aren't naturally partnerships all the time. We're regulators, we're payers, but in our state we were able to overcome the challenges of our long-standing relationship and to work together to make sure that nursing home safety was at the center of everything we did. We were, as the Commissioner noted, we were out in front on, as soon as that first wave started to subside, we were out in front, and the governor was committed to make sure that subsequent waves, our nursing homes would have all the protections that they need. We're one of the first states in the country to sign up for the long-term care vaccination program. It was in December of 2020, a very cold day like today, that the governor and I were overjoyed to be at one of the very first nursing home vaccination clinics in the state of Connecticut and one of the very first in the country. We have been distributing PPE, testing supplies to our nursing homes, and we made sure that every nursing home in the state had a testing partner from the very beginning, as soon as testing became widely available, so that they could test residents and staff. We were ahead of the federal government in requiring nursing home staff to be tested, and we continue to make sure that staff were having weekly tests whenever the infection rate was high in the state of Connecticut. And finally, I want to mention the financial support that the governor has made sure that we supplied to the nursing home. It's been a very challenging couple of years for the industry, not only in Connecticut but around the country. We were able to deploy coronavirus relief funds. We were able to deploy ARPA funds and state general revenue through our Medicaid rates to make sure that the nursing home industry was able to weather the storm. We provided, in this biennial budget, over $170 million to make sure that wages were increased. You heard about the challenges with staffing. That's a challenge not only in long-term care, but in all of healthcare and all around the country. The governor has made sure that we were providing resources for raises and pension benefits to make sure that the nursing home industry had the resources they need to recruit and retain staff. So we hope there won't be another wave. We hope there won't be another variant. But what we do know is that the strong partnership we formed, we will be ready. We have the tools that we need. We have the supplies that we need. And most importantly, we have the partnerships that we need in the event of another wave, and that our nursing homes and our residents will be safe. So with that, it's my pleasure to introduce Governor Lamont. Thank you.
Well, thanks, Deidre and Amy, and I think Mark said it pretty well. I've just been admiring this. We got this. Stopping the spread of COVID-19, one vaccination at a time. We got this. And Connecticut, I think we've got this. If we can do it safely in the nursing home, we can do it safely beyond. Look, as you heard, Connecticut nursing homes were particularly hard hit going back a couple of years ago now. It was the scariest time of my life, and there with Deidre and the team, you know. And we wanted to make sure that that never happened again. And one of the first things that Deidre did was we hired the very best outside group that could take a look at nursing homes and tell us what to do and tell how to do it right and what the changes we can make and make sure this doesn't happen. That was the mathematical report. We got that out, and as soon as we had it, we made that public to everybody so we could all learn from it. And I think we have learned. And I think you can tell that we have learned, as Manisha said, by the fact that each subsequent wave, Connecticut has done better, and our nursing homes have done much better. You saw that tiny little graph, for those of you with really good eyes. But what it said was, during those first few months, the fatalities per capita at nursing homes were much higher than they were in the greater population. No great surprise there. And if you had really good eyes, you could see that the fatalities per capita in nursing homes today are much lower than they are in the general population. And that's because Doncaster's done it right. We were strict, you know. We said, I want everybody to get vaccinated. We prioritize folks at nursing homes. 99% vaccinated and boosted. What an extraordinary difference that makes. I want to thank our friends in the legislature who, maybe let it rip. We don't need any more rules. And we stepped forward, so we have a very narrow group of rules we think can help keep people safe. One of it is coming into a nursing home. I want all of our nursing homes to be as successful as you've been in terms of the boosters. And I think it's appropriate that if you haven't been vaccinated, you want to come in and visit a loved one, that you take a test. Because we realized going back, a year and a half, 2 years ago, that travel in and out of the nursing homes that could create an awful lot of risk to the population. And we've learned. And, this is a nursing home where, they don't really want me to say it, but I might as well brag on you just a little bit that not only, going through Omicron, not only doing this with the mask, not only doing this with the vaccinations, where there are no fatalities, but there were no infections. And I can't promise that forever, but it shows you that this works. I want to give a special shout out because this nursing home, amongst many others, also took some of the recovering patients from the hospitals, got them here into the nursing home where they have single rooms, able to quarantine safely, able to help these people get back on their feet and open up capacity in the hospitals for other folks that are there in need. So we really wanted to be here today to say thank you for getting it right. Thank you for being an example, I think, for the rest of the state. And John, I think you're pretty fortunate to be affiliated right here with this amazing facility. And, love and care I hear just talking to some of the staff, that's the most important medicine of all. Thanks, everybody.
Any on-topic questions?
Yeah, Governor, as you reflect on, and we've done a lot of reflecting today, as you reflect on the many ways that you've steered the ship over the course of the pandemic with regard to all the different policies in nursing homes, is there anything that you would have done differently?
Yeah, when the federal government said, don't worry, we got this national stockpile, we got all the masks you're going to need, we got vents, give us a call, we'll get you delivered in a week from Thursday. Trust but verify. And there was nothing there. And that's when we started our mad scramble around the world to do everything I could to get masks and other PPE, which is the first priority we had to the nursing homes. 90% of the nursing homes were able to manage pretty well. Some of them were overwhelmed. Believe me, we've got a stockpile in New Britain. We're ready to go.
The other thing is, as we talk about, all the successes, and there have been a lot of successes over the course of the pandemic, whenever I've done a story on nursing homes, I've always said nursing homes, to me, have been the story of the pandemic. They've also been the tragedy of the pandemic. 70% of all the COVID deaths in Connecticut have come out of long-term care. So what do you want to say to all of those families who have lost a loved one?
That when you lost a loved one, we all lost a loved one because we're all part of the Connecticut family. And I got to make sure that despite that tragedy, we've learned from it. If we haven't, shame on us. And I'd like to think the story you're hearing today shows we've learned from it.
Governor, you referenced the mathematical report. That report said your administration failed to consider nursing homes in its early stages of planning the pandemic response. Isn't that a bigger mistake than difficulties with getting PPE with the federal government? I mean,
no, I don't think so. I'll let Deidre handle that because she's, I think, was closest to that report. But look, what I want to do is say, what could we have done differently to make sure this doesn't happen again? Obviously, masks were a very important piece of this thing. Obviously, disinfecting was a very important piece of this thing. They generally gave pretty high marks to what we have done. And obviously, we could have done a lot better. And I think you see that we are doing a lot better. But Deidre, do you want to add to that?
Yeah, I think the Mathematica report said that in our planning for the pandemic, the state could have done a better job of including long-term care in that planning. We don't disagree. I think that's what we're talking about today, how we have been able to partner with the industry, with our Department of Public Health and all of the inspections and PPE distribution and support and instruction and partnering with patients and families. So we are planning for any subsequent waves, and those lessons learned are being taken into consideration.
I have a question for my colleague, Christine Stewart. She couldn't make it here. And she wanted to know if state officials and industry representatives here are concerned visitors will no longer have to show proof of vaccination or a negative test as of March 15th.
So right now we have the executive order in place to be able to enforce that at local nursing homes. CMS continues to provide guidance to nursing homes so that nursing homes can do what they think works well for them as well in terms of visitation. Lastly, I would say that what we've seen with Omicron is we are seeing a steady decline in hospitalizations and cases every single day so far. So our hope is that as we continue into this spring, we will have less prevalence of disease, less virus circulating. One thing as a community we're going to have to all get used to is that as there's more virus circulating, you scale up the interventions you do to protect yourself. As it dissipates, you scale down. We all know how to do this with the weather. When it gets cold and you crank up the heat, maybe you put on the mask, maybe you test a little more, maybe you wear different PPE in different settings that you may be entering. As it gets warmer, we turn off the heat, maybe put on the AC, maybe you scale back on some of those interventions. This is no different. We're going to learn how to live with this virus. We're going to have to ramp up and ramp down. Nursing homes have the tools. They know this playbook. We also know how to deal with different variants as they will come. And believe me, we are not going to be asleep at the wheel. We are planning right now for what might come in the future. We don't know when or if it will come, and our hope is that it won't. But we have to be prepared should that happen. And to the point of dealing with public health emergencies, nobody knew about pandemics and public health and what does public health do. Everybody has seen what public health does every day. And public health is doing this even when nobody else is paying attention to this. So we will be ready the next time should something like this happen.
And if I could, I have another question for a colleague.
Can I respond to that quickly too?
Sure, I'd love to.
Sorry. So I just want to take an opportunity to say, I don't think there's anyone in our state who values the protections and the protocols that have been put in place to keep residents safe more than loved ones and visitors, essential caregivers. They want the guidance, whether they're required to test or not. They're the ones, they want to be boosted. They're going out. They're ensuring that when they go in, that they're safe. They want to be able to continue to have access to their loved ones. So I think it's great that there are protocols in place right now, but from what we're hearing from residents, family members, and other visitors is that any information they can have to help keep them safe and keep visitation open, they would welcome.
Just the other question concerned the hospitalization. Why are we seeing more, the number of vaccinated patients are now exceeding the number of unvaccinated? And I know a lot in the past it was because people show up at procedures and, or for emergency care and then they test positive. But what, can you fill us in what's happening now?
So I think there are a couple of different things in that. Number one, what we know is that there is waning immunity. That is a reality. Getting a booster shot helps bring that immunity back up, and it's been sustained at very high levels 4 or 5 months out from booster shots, what we're seeing, what's happening in real life. And unfortunately, particularly if you are older and you have not had a booster shot, and if you're unvaccinated, of course you are at greatest risk. This is one of the problems. So I think what you're seeing in some of the trends is that there are people who've been vaccinated but might not have been boosted. So that is one piece of it. The other piece of it is that there is sometimes the situation where people are admitted for something else but also happen to have COVID. But sometimes for very debilitated people who have multiple comorbidities, it's difficult to even tease that out. You know, if you have a heart attack or a stroke, is that COVID related or not? That's difficult to tease out because those things can happen with COVID too. So as there's going to be more and more prevalence of this disease with a virus that's very infectious right now, particularly with the Omicron variant, we may see more of a shift in that way. But that just gives us more reason to go out and get boosted.
Back to the nursing homes, there's been, we're in a beautiful facility today, but not all facilities are set up like this. There are many that are old. They don't have enough rooms to individually isolate. A lot of them don't have enough staff to be able to just put them with COVID positive, patients versus others. So what do we need to do going forward in order to modernize the physical infrastructure of some of these older facilities in order to set them up to better be able to handle infection control?
So I think you bring up a great point. The first and foremost is every single nursing home can only care for who they have the staff to care for and the facility to care for. So it would not be possible to take care of patients that you can't care for appropriately. So that's first and foremost. Now, in terms of improving the infrastructure of existing homes, this is where we continue to work with our industry partners, with different companies that are in the state, to be able to see how we can optimize the care that is being provided in the facilities that are here. And this is what a number of industry partners are having to face as they look at what their aging infrastructure is and whether they need to consolidate or maybe upgrade certain homes or think about which ones might not be quite at the same level that we need. And I think Commissioner Gifford has additional comments.
Yeah, I just wanted to add that we've been working with Mag and Matt and their members on this issue. And as I mentioned, it's been a very challenging couple of years for the industry. As part of some of the financial support that the governor provided for nursing homes, we asked them to share with us this spring what their plans are if their occupancy has not bounced back to something close to pre-pandemic levels. So the nursing home industry is, as we speak, working on strategies for what to do if their occupancy does not rebound, and how we can partner together to ensure that we have the high quality facilities, that we have the most resident-centered facilities, that our financial support at the state level is appropriate. So that's going to be an ongoing process, and we're partnering with the industry to work on that.
To your point, even before the pandemic, the census of beds in nursing homes, there were a lot of beds available, and over the course of the pandemic, we've seen many nursing homes close, shutter. How many more do you think will close? And what can we do to get them on a better financial footing? We know there's Medicare reimbursement issues.
So as I mentioned, first of all, the governor, working with OPM and DSS and our industry partners, has provided a lot of financial support over the course of the last 2 years to make sure that our industry could weather the storm. But it is a time of transformation for the long-term care industry writ large. And as you mentioned, that situation predated the pandemic. People want to age in their homes if they can. So we're working hard to support the kind of home and community-based services that would allow people to age in place if it's appropriate. With respect to beds, there likely will be further consolidation and closure. If there's not a demand for nursing homes, then that will play itself out. What we want to do is make sure that we have a payment strategy for Medicaid, which pays for about 80% of the long-term residents in nursing homes, that we have a payment strategy that supports quality, supports patient-centeredness, and helps support the right size of both home-based and residential long-term care.
Governor, I had one question to follow up on Paul's question. Now that your powers have expired and you have this essentially new March 15th deadline, where do we go going forward from here? In other words, the nursing home extension, for lack of a better term, as far as people being tested and coming in, goes to March 15th. Is that long enough? Should that have been longer? Are you satisfied with that deadline?
I think it could have been longer, at least a little more flexibility. But Mairead said, look, we got March 15th. Legislature's still in session. If we find a zombie crime comes along, something's changed, we got to maybe do a little stricter to keep people safe here. I go back to the legislature. But I love what you said, which is, 95% of the people coming to visit the nursing homes, feel a lot more confident that they're either vaccinated or tested. And I think a lot of this now going to be self-police because people know how to do the right thing.
But Governor, the temporary change made to the two emergency statutes that requires legislative approval of any emergency declaration expires on March 1st. So after that date, you'll be free again to issue either kind of an emergency declaration under when it reverts to the old statute, which won't require legislative approval. Are you saying now that you're not going to take that step, that anything you do going forward, you will seek the legislature's approval? Or are you not going to
Look, the legislature's in session. They're in session for the next 90 days. State Senator Kevin Kelly, really focuses on elder care. I like to work with people. I like to work with the legislature. I think you've seen that for the last week, and I think we'll continue along those ways. If everybody goes away on vacation and zombie crown hits and all of a sudden it's September, maybe we'd have to take other emergency steps, but I do not foresee that happening. Tell Christine the other piece of the question. Hey, what's going on? 50% of the people hospitalized had some vaccination.
Well, that was one of my
Okay, yours. I turn that on its head, though. You think about the fact that, say, 85% of our eligible population is fully vaccinated, 95% have, some level of vaccination. That means that those 10% who are not fully vaccinated, represent over 50% or represent 50% of the hospitalizations. They are 5 times more at risk, 5 times more likely. I think that's the salient piece of that fact.
Governor, I don't know if it was discussed earlier, I apologize if it was, but for staff that took care of everybody in long-term care facilities during COVID, it was very apparent that they're working 2 and 3 jobs and going from home to home to home. Is there anything being done by the administration to make it so that those folks don't have to have 2 and 3 jobs? Because it seems as though that helps spread everything.
Well, as usual, I'm going to pass this right to Deidre, but I will tell you that that was a risk, especially early on, especially when folks weren't vaccinated, and sometimes that nurse, traveling nurse, might come into a nursing home and bring the infection with him or her. I'd like to think that's a lot less risk today than it was then because people are vaccinated and even boosted. Anything else you want to follow on that?
Yeah. I'll just give you some numbers from this biennial budget. A total investment of $172 million for health and pension and wage increases. So almost $23 million in fiscal 23 for health and pension enhancements, $47 million in fiscal 22, and $102 million in fiscal 23 for 4.5% wage increase. So, yes, the administration has made significant investments, and those are targeted specifically for wage increases. They're not to go to other types of investments that the nursing home needs to make. There's been tens and millions of dollars in other CRF and Medicaid temporary support to help defray some of those other pandemic-related costs. Welcome.
Thanks, everybody.